Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
And we've had Boris Johnson coming out today, putting pressure on the government, which he's a part of, and on Brexit, which he's also a part of.
Yes, that's right. Boris Johnson has made the rather unusual move as Foreign Secretary of launching a video for a new campaign group called Change Britain, which is intended to pressure the government to deliver on its promises about Brexit. He has appeared in a video clip saying this is all about bringing Leavers and Remainers together, but saying that the government needs to control trade, money, laws and immigration. We can see some of that now.
No longer will British governments be incapable of controlling immigration. And no longer will it mean that when we make our laws in Westminster, they can be overruled in Brussels. To build a country that is fairer, that takes account of the needs of the people who feel left behind, to make sure that we can take back control of our money, of our borders, and of our democracy. If you're encouraged by this vision for Britain, if you want to get involved, then please sign up. Help us change Britain.
Well, it's rather unusual for the Foreign Secretary, who's of course intimately involved in the Brexit negotiations, to be wanting to hold the government's feet to the fire. Interesting what he doesn't mention in that video clip. He talks about controlling our borders. He doesn't mention the single market, however. You notice some of familiar faces from the Leave campaign are involved in this new group Change Britain, including Michael Gove, including the former Chancellor Nigel Lawson and Steve Hilton, who used to advise David Cameron, all seen as rather hostile to staying in a single market if it means we can't cut immigration. Also, no mention of £350 million a week, which would be sent to the NHS, as emblazoned on the Vote Leave buses. Now, Downing Street say they are relaxed about Mr Johnson's role in this campaign group, but the chair of it, the Labour MP Gisela Stewart, who was involved in Vote Leave, says it is intended to hold the government to account.
And I very much hope that the work we're doing will be significant in the lead up to a decision to trigger Article 50. So for me, this is an important organisation from now until the moment that we've left the European Union, and to make sure that that we work as friendly outsiders with the government. But if we think they get something wrong, we'll say so.
Now, Boris Johnson's aides insist that he's not having any kind of formal role in the campaign group, although, of course, the risk is that if it criticises the government, that he will be linked with it. One of his big ideas about an Australian-style point system for immigration has already been slapped down by Theresa May, so the government will be hoping that his vision of Brexit chimes with theirs.
OK, tomorrow in Westminster, thanks very much.
A 7-day NHS is impossible to deliver, according to the body which represents England's hospitals. NHS providers boss Chris Hobson warned the service was already so overstretched and under-resourced that something has to give. The Department of Health said it would be funded by an extra £10 billion a year by 2020, along with thousands more doctors and nurses. But frontline staff say the new plans are simply unrealistic. Here's our health and social care correspondent, Victoria MacDonald.
It's been a difficult couple of weeks for the Health Secretary. Junior doctors' strike action announced, NHS waiting time targets missed again, the highest ever number of patients on waiting lists. And now, this man, representing the heads of trusts across England, has issued a stark warning that the health service is close to breaking point.
So we've reached a tipping point. The hospital, community, mental health and ambulance trusts that we represent are saying they can no longer provide the right quality of care on the money available, and that effectively we cannot carry on in this way. We have to either put more money in or make some tough choices about what we do next.
This is the reality, Mr Hobson says. The NHS in England needs at least 4% a year to meet patient demands and costs. This year it received 3.8%. Next year that falls to 1.4%, and the year after to 0.3%. Something, he says, has to give.
It's highly unusual for an organisation like NHS providers to speak out so strongly, but they've said they have to because they're getting messages from their members, trust chief executives and others across the NHS, that they are struggling to cope. What's more, it's not the only warning. In the past week, the Royal College of Surgeons has also said that the health service is now in a permanent state of winter.
No ministers were available for interview today. In a statement, the Department of Health said,
"We are giving the NHS the £10 billion it asked for to fund its own plan for the future, including almost £4 billion this year to transform services and improve standards of care. We know the NHS is under pressure because of our ageing population, but we rightly expect the service to continue to ensure that patients get treated quickly."
Now the health service is looking towards the autumn statement for some reprieve, although NHS providers deny that's why they're speaking out now. Yet people will be watching, partly because of this. Now you see it. The Leave campaign's £350 million a week pledge for the NHS prominent on their website. And now you don't. It's gone. Once called Vote Leave, now they're called Change Britain. The new website makes no mention of the NHS. Money from leaving the EU, they say, should go into farming, science, research and poorer regions of the UK. And the Prime Minister herself has refused to commit to the Brexit pledge. Facing the government too is their general election promise for a 7-day NHS, already at the centre of a bitter dispute with junior doctors, in which few in the health service believe can be achieved without more staff and more money.
Victoria MacDonald. Well, with me now is the Shadow Health Secretary Diane Abbott and the Conservative MP Chris Philp. Thanks for coming in, both of you. I mean, Chris Philp, this is an absolute shambles, isn't it? I mean, it's hard to know where to begin. You've got the strike threat, you've got a funding crisis, you've got every senior NHS boss virtually saying the system is broken. What are you going to do to fix it?
Well, hang on a sec. This is the government which has already increased NHS spending by £8 billion from 2020.
But it's not enough.
To 2015. Let me finish. 2020 to 2015. It's increased the number of doctors and nurses by 10,000 each. And the NHS 2 years ago, Simon Stevens, asked for an extra £8 billion between now and 2020 looking forward. And the government delivered not £8 billion, but £10 billion. So when the NHS asked for extra money, the government was there to give it. Now, if it turns out that there are problems and for some legitimate reason more money is needed, I'm sure that will be looked at because the last government and this one is committed to making sure the NHS works for everybody.
So who's to blame here? Because you're right, you have increased your funding quite substantially, but these senior bosses who are running the place are telling you over and over again it simply isn't enough. So are they getting it wrong? Are they getting their accountancy wrong?
So don't forget, the Stevens plan published 2 years ago envisaged £22 billion of efficiency savings over the next 4 or 5 years. So I think we need to make sure those efficiency savings are delivered. Let me give you 2 examples. We're spending £4 billion a year on agency and locum staff. That's up 10% year on year. One local locum doctor got an incredible £500,000 a year. So one of the parts of the efficiency plan is to get that under control. A second area is spending on drug procurement. There was one drug, Weldorm, which went up from £12 a prescription to £138 a prescription. So that pharmaceutical purchasing needs to be sorted out as well.
Okay.
Now, if after doing all of that, we still need some more money, I believe this government will be there to support the NHS as required. As a Conservative MP, I certainly will be.
OK, Diane Abbott, do you actually have a viable plan to fix the NHS where they can't?
Well, first of all, when he says that if it turns out there may be problems, we know the system is under huge stress. But what I think you need to do 3 things. First of all, we shouldn't be treating the staff like the enemy within. This row with the junior doctors was totally
mishandled. This is another issue, though, isn't it?
No.
Today what we're talking about is fun, it's about money.
The NHS is only as good as the morale of its staff.
Yeah, but this is about money that we're talking about today.
The other thing we should do is look for savings. The £3.6 billion that's been spent on agency staff, the billions a year that's spent on PFI, we ought to be bearing down on that, and the drugs bill. And then what we have to do in the medium term is to address the public health issues. 10% of the drugs bill goes on drugs for diabetes. If we spent more on public health, we would save infinitely more on the health service in the medium term.
Do you still believe that renationalising the NHS, as I think you've suggested, is the right way to go?
I certainly think that there is no public appetite for privatisation, and bringing the private sector into the NHS is just bleeding it of resources. The public want a national health service which is free at the point of use and a genuinely national service.
And you think that renationalisation can achieve that?
I think that we don't want to go further down the road of privatisation. There's no evidence the public wants that. And there's no evidence, actually, in totality, that that provides a better service. And just one more thing. The government has slashed funding for local government, and it's the cuts in the money available for social care which is putting so much pressure on the NHS.
Well, look, Diane Abbott criticises PFI. It was, of course, Gordon Brown who introduced PFI as an accounting con. So that's one point to make. Secondly, 94% of NHS work is done by the NHS, only 6% by private providers. And to be honest, if they can do a good job for lower prices, there's no reason why we shouldn't use their services. What I'm concerned about is good healthcare for patients and good value for taxpayers' money, not some kind of ideological dogma. But the main point is we've massively increased health service funding because they asked for it. And if there's a good case for more funding because it's needed, I'm sure that will get a sympathetic hearing. But let's see these efficiency savings delivered as well.
But the problem seems to be that however much we save, whatever efficiencies you put in place, you're still not going to fix the problem fundamentally. The demand is simply too great, and the funding that you've come up with, even with these increases, simply isn't enough to keep pace with the demand. And that's your fundamental problem.
Yeah. Look, I mean, the idea of NICE, which was actually a Labour innovation, which we've maintained, is to decide what is affordable and what makes sense. And clearly, there is a sort of almost limitless universe of treatments that are theoretically available. And you're right, we do have to make judgments about what is reasonable and what is affordable. But we do want to make sure that all the treatment that is important and necessary does get funding. And I think that is the Conservative commitment.
Okay. What do you think, Fanny?
Just to say, I have always been against the use of PFI hospitals and always voted against it. And the expanding demand from the elderly, that will be met by actually taking a very innovative and putting money into public health.
All right. Dan Abbott, Crystal, thanks for coming in.
I've been getting away with it all my